G'day, my name is Hamish Morrin. I am a teaching fellow in veterinary nursing at the Royal Veterinary College. And what I'd like to talk to you about today is the concept of moral injury. And what we're going to talk about is what it is, and how it relates to the veterinary profession, how it relates to some of the ethical challenges we face these days, and how it relates to other issues such as burnout and compassion fatigue that are such a challenge in our profession.
By the way, check out the code in the description for 50% off your first webinar at Webinar Vet.
So, starting from the beginning, what is moral injury? So, I've chosen to use a definition from the NHS. There's not a very specific definition that's broadly accepted for this, but it can occur when somebody engages in or fails to prevent or witnesses acts that could conflict with their own values and beliefs, and when they experience betrayal by trusted others, especially when this is perceived as avoidable, or when they are powerless to change it. Moral injury is something that we potentially can face in the veterinary profession. Now, originally, this concept was brought about by research into the military and people who had in their experience of wanting to perhaps fight for their country, to help people to be a positive force. They found themselves taking part in actions that challenged their belief of themselves as a good person. But it rapidly transferred to the medical area. And the reason for this is clear, and it's clear for veterinary profession as well, in that we often face difficult ethical dilemmas where the values and desires of the owner, of the veterinary team, of different parts of the team, of management, etc., might clash, and we may end up having to make decisions or take actions we don't really agree with and that don't fit with our view of ourselves as compassionate or empathic people who care about animals. The really obvious examples would be in areas such as futile care and convenience euthanasia. We might be having to euthanize an animal that we feel is healthy and could have a good life, could be rehomed, could be looked after with better care, or alternatively an animal that we feel has reached the point where euthanasia is the kindest action, the most justified action, and yet we are in a situation where we have to carry on providing intrusive treatment that that animal finds aversive. But they're not the only examples, and certainly looking at the challenges of the COVID-19 pandemic, there has been an increase in the difficulty around dealing with owners and people, where owners are often themselves faced with very stressful and difficult situations and can lash out at veterinary professionals. And statements such as, "You don't really care about animals, you're just in it for the money," are deeply hurtful to a lot of us because they strike at our core value that we believe exactly the opposite, that we are putting the animals first, above ourselves, above our own needs and wants. Also, issues such as bullying and incivility have been raised in our CVS surveys, and again, these can leave us feeling that we are trying to behave in a good way, in a way that is compassionate to our teammates, and we may feel that it's not possible for us to do so. Now, it's important to make the point that moral injury isn't a medical diagnosis. It's not like post-traumatic stress disorder, although there is a certain amount of correlation. And in fact, looking at the literature these days, there is quite a strong belief that it should not be a psychological diagnosis. Partially because it's hard to make, but largely because this is a question of values. The problem of moral injury arises when our values are clashing with the values of other people and with the actions we have to take. It would be a very strange world if we looked at this and said, well, actually you having values and wanting to express them and live by them is a sign of mental illness. That would be very difficult for most of us to swallow. It's a natural response. The problem doesn't come from that. The problem comes from the fact that having this experience of facing these problems can cause us, through moral injury, to then have psychological and physiological symptoms that can lead to depression, post-traumatic stress disorder, and other diagnosable mental illnesses. Now, the research of how prevalent this is in the veterinary industry is limited, but it does show that it is there. There have been surveys mainly of veterinarians, mostly in America, where they do show that this is a common problem. And there is a lot of research in human medicine, especially around nursing, with people facing a lot of very similar problems to those problems that veterinary nurses face, especially around the challenge of end-of-life care or feeling that their voices are not valued, that their judgment is not considered important. And so the research is there to suggest that this is probably an issue for us, even though it hasn't been really fully explored in the veterinary industry. However, having brought up these sort of key facts of what moral injury is and how it might affect us, the next step is to look at is, what are we going to do about it? Assuming that it is there, that it is prevalent, and it is potentially a problem for people in our industry, what are we going to do? Luckily, there is a lot of research within the medical profession about possible ways to do this. Now, there isn't a clear answer. It's a complicated issue. People have very different values. They respond differently. Many people face ethical dilemmas and come away without any sense of injury. Others find certain things really challenging. There's not an easy answer. It is in many ways a lot like other things we do in the veterinary industry, where rather than having one answer, in clinical issues, in welfare issues, we often use a toolkit of practical interventions that we can make that are helpful and useful, and we apply them to different situations, and some are more useful than others. So some key interventions that have been brought up that we can consider. One is a sense of moral agency. Now it's a fairly simple concept really. It's the fact that your voice matters and your values are important. Quite a few surveys of people in difficult areas such as end-of-life nursing care found that especially nurses who were in this situation, also physicians as well, who were dealing with families, dealing with patients who were struggling, coming to the end of their lives, having a difficult time, very much felt that the ability to speak their mind, to discuss things with other members of the team, to discuss with the family, with the patient, which is less relevant to us. That ability to have their voices heard made a huge difference to their mental health and their feeling that they had the ability to influence the outcome. Regardless of whether the outcome was actually what they wanted it to be, just simply that sense that their voices were being heard. And I think there's a lot of work happening now in the veterinary profession to ensure this is going to happen. A lot of work around decreasing incivility, improving communication, increasing diversity and equity among the profession. A lot of people are doing some tremendous work in this area. And developing moral agency could be another benefit of working in this area, that we accept that we all have values and those values matter, even when we might not always be happy with the outcome of a particular case. The chance to speak up is important. Now that leads me on to another key aspect, which is the sense of moral community. Now this is something that's probably been heavily challenged over the last couple of years in the COVID-19 pandemic. A lot of medical professionals talked about the ability to speak with their colleagues, to discuss issues they found challenging. And they found the sense of being able to share these issues with each other, discuss them, help each other come to terms with decisions they didn't like or to come to solutions that they could accept was a huge benefit to them. Unfortunately, we are in a situation now where for a lot of us, contact with our teams and our peers has been restricted. And that's probably one of the contributing factors to these issues of burnout, compassion fatigue, moral injury that so many people in the profession face right now. Now, a lot of people have done a lot to improve this with trying to keep things alive with WhatsApp group, with Teams meetings or Zoom meetings. We're trying to keep connection with each other. And now that we are more able to spend time with each other, there's a lot to be said for having time for this. The important word there is time. There must be time within people's day where they can discuss the cases they are seeing. They can, not just the clinical aspects, that they can actually discuss how they feel about things. Now, often we're under a lot of pressure to get a lot of work done in a short period of time. And it's important to note that solving moral injury won't just come from individual action. We have to work together. Moral communities means that the workplace needs to allow people to have time to discuss these issues and allow for their voices to be heard. There are other options. In human medicine, in some areas, ethics committees are used often, and especially around clinical care in large hospitals and across things like whole NHS groups. Ethics committees are a more formal version of this moral community where people have this chance to sit down, different representatives of different part of the industry get a chance to talk and share their views and opinions, and it's a more formal situation. Now that makes it perhaps less accessible to people than a moral community within their group, but it also has been shown that people also consider it as a greater chance of having their voice heard, a greater chance that their recommendations will move up the line, will be read by people with decision-making powers, and will be seriously considered. So it is another option we could pursue. There are many other things. There is so much overlap with other ethical issues, which I hope to talk about in further videos around post-traumatic stress disorder, burnout, about the moral challenges that we face as a profession, about our values and how we express them, both in our everyday actions, and about how to be morally resilient, not just as individuals, but also as teams, as practices, and as a profession as a whole. Just like so many of the problems we face right now, there is no one simple, straightforward answer. A collection of tools that we apply across a range of different operational situations, from small practices to referral hospitals to charity organisations. Different aspects will be useful. But there's also a lot of overlap with so much we're doing towards improving mental health, to improving the welfare of people in the profession, that actually there are a lot of actions we can take that will benefit people in multiple ways. So a quick summary of this very rapid introduction to the idea of moral injury. It is an established problem for people like us, for people who face difficult ethical challenges on a daily basis. It's not a medical diagnosis, but it can lead to personal harm. And there are actions we can take to reduce it, that we can act to improve our own moral resilience, our own understanding of ethics, that we can improve our moral agency, our moral communities, and our chances to speak out. And if we take these actions, then this gives us a chance to help support each other and provide an environment where we'll all feel a bit more comfortable with the decisions we make, and hopefully it will improve everybody's well-being. Thanks for your time. I hope this was useful to you.